go off camera, feel free. Welcome everyone to our Integrative Psychiatry monthly meeting. I am delighted to present this month's speaker and topic. Dr. Chris Kalibi from University of South Florida is here with us to share on the topic of rules of thumb, why integrative psychiatry creates better outcomes. Dr. Kalibi is a dear colleague and friend. He is professor of psychiatry at University of South Florida in Tampa. He is board certified in psychiatry, child and adolescent psychiatry, and forensic psychiatry. He's a distinguished fellow at the American Academy of Child and Adolescent Psychiatry. His clinical work has been primarily in university clinics, federally qualified health centers, and juvenile corrections. At University of South Florida, he instructs medical students, residents, and fellows, as well fellows in child psychiatry, as well as forensic psychiatry. He is concerned about native interventionalism in medicine. Naive interventionalism in medicine. And Dr. Kalibi's academic philosophy is skeptical empiricism. So with that, welcome, Dr. Kalibi, and we are so grateful to learn from you.
So let me go back. There we go. There's my title. That's me. You already know that. I will say I'm going to talk about what got me into integrative psychiatry, and it will be a lot of criticism regarding how the standard practice that I see out in the world. And I'm going to try to go pretty fast through it. So hopefully we'll have a nice discussion at the end. Apologies if you've seen any of this before, because I do want to hammer a few themes. But one of the problems in modern medicine is that we haven't built a system that really prioritizes health. And that's why I think integrative psychiatrists can do a better job and do a better job, is because they are aware we're open that we have a disease management system and not a health optimization system. We know that we're set up to churn out patients, and we don't have a lot of time to address some of the basic things. And if the basic things are not right, nothing is going to be right. The other thing that I think is a problem in modern medicine is there's a lot of focus on sort of reductionist measurement and not a look at the whole patient. I don't see the biopsychosocial in-depth evaluation of the patient like I was taught, and like as I think psychiatry should be practiced. We get a lot of assumptions like, hey, if you do a PHQ-9, let's do the thing, it's depression, okay, here's your medicine, move on, next patient. You see a lot of that in medicine. I stole this slide, and I can't remember from where, but it was from another integrative psychiatrist. So my apologies. But you see the pills and surgery line well full, and the lifestyle change one just sitting there. James Gordon says that self-care is a heart of healthcare, and clearly this is a primary issue in modern medicine, that we are not doing a good job of helping patients take care of themselves. There is that other 20% of medicine that's acute care, that's illnesses that even if you take great care of yourself, sometimes people are going to get sick, they're going to get a cancer, they're going to get in an accident, they're going to need crisis intervention. But really 80% of healthcare is related to taking care of yourself, managing modern stress. And our failure to better address this, I think, does come with a problem with our culture, which I will get into, and problems like I was just talking about the system. Naive interventionalism will come up a few times. We have a bias towards doing stuff in medicine. It's very hard for us to sit on our hands and allow the natural healing process. And I think integrative practitioners are aware that people heal and grow with time, and that we are there to support them. We do not very often have cures. We can help people heal themselves. One of the problems in modern medicine is that because we have put together a lot of high achieving and high empathy, and this is especially true in psychiatry because we're selected for agreeableness and empathy to go into this field. We really want a mutually affectionate, warm interaction with our patients, which is great when you can have it, and a lot of times you can have it. But what happens is if you have people from a culture that is telling them that medicines are the solution to their problems or that they need other interventions from mental health, that then we're in a place, if we want to practice, holistically, of often saying no, that there's other things other than medicines. But we have trouble saying no overall in medicine, but I would especially say so in mental health. Anna Lembke's book, Drug Dealer MD, is fabulous, and she takes a really good look at what happens in medicine and the psychology of, in this case, prescribing opiates. And we often are, because of our wanting to get that warm fuzzy with the patient, and because we are now in these systems that are really focused on patient satisfaction as the outcome. You can look at some of the there's a 2013, I think, JAMA or New England Journal article where patient satisfaction was correlated with mortality. So it's not necessary that patient satisfaction is the best outcome, but we're very much measured on it, and I train residents, and they're afraid sometimes that someone's going to either go on Google or complain or whatever, and all of us would like that not to happen, but realize that that is a part of modern medicine. As I mentioned, interventionalism, which I'll get back to why that's a problem, but we tend to do stuff rather than figuring out what's gone wrong and trying to correct what's wrong, which often means taking something out of someone's life. We don't have a system that's good at doing that. I mentioned churn, and then because of the way we're trained and probably who's selected for medicine, we have trouble thinking outside the box. We're not as open-minded to other things in most of medicine, and I think integrative medicine is where you get the more open-minded people, and you get people really willing to look at stuff. I'll get into it, but I think this is part of the problem, is that we are not open-minded enough in medicine, and we take ourselves a little too seriously. Another barrier is that the culture we're in has a lot of people that are not physically or emotionally healthy. And if you look around, what percentage are you finding that you'd really say that about? And if that many people are not healthy in this environment, how did we get that way? How are we really thinking about what are the problems that are causing us to have this unhealthy environment, and what can we do about it? I have the Pilar Gerasimo book is excellent, and she talks very much about how to navigate this unhealthy world. But one of the things that is not mentioned, that if your world has a whole bunch of unhealthy behaviors and attitudes, and maybe even emotions which are contagious, how do you fight against those things? How are you going to not do that? And it requires being a little weird. And so I think we're not afraid of being weird in integrative psychiatry, and we know that you have to kind of break the mold. We can't be doing things like it is going on everywhere else in our culture, and we have to fight that unhealthy default reality with getting a little weird. I put this slide, I think, in the last time I presented, but modern overconsumption dilemmas. We have whole industries trying to get us hooked. And so it's the highly palatable food, the video games, the social media, the television, gambling, substance use, tribalism, all those things pull us naturally and are part of the human makeup. But then we have industries bringing them to us. And so we're over consuming a lot of things that are undermining our health. And in these sort of what I would call diseases of civilization, the only cure is going to be taking away the toxic thing. There's not going to be a medicine that you're going to add on if you keep this highly overconsumption oriented lifestyle. Back to it was already mentioned that my academic philosophy is skeptical empiricism. I take that from Nassim Taleb and from this book, Anti-Fragile. Anti-Fragile is the idea that in our culture, in our language, we don't have a word that is the opposite of fragile. We have like robust and strong and resilient and stuff, but that's a little different. Anti-fragile means that you get stronger when you are stressed. And if you think about the human body, there's many easy things that you can think about. Our bones, when we pound them, they get stronger. Our muscles, when we work them, they get stronger. And it's the same with human beings regarding stress and emotions. When we go through things, we can become stronger. And so within a range, you do get stronger. If you go beyond that range, then you get injured. And we need to figure out how to keep stressing ourselves in the right kind of way. Nassim Taleb says many brilliant things. He's the one that's talking about naive interventionalism, which is we don't often know what all the ripple effects and iatrogenics and negative things can be with our interventions. Yet we're so willing in medicine to prescribe things, and a lot of our stuff is like, hey, we have a 3-month study or a 2-month study about this, but we want people to be healthy for their whole life, not for 3 months. And do we really have outcomes on our stuff, even the stuff that we're prescribing all the time? Do we know that in the long run that they're doing great? Because we keep prescribing more and more, and we keep having overall outcomes for our society worse. We have more mental health problems than ever, and we're prescribing more medicines. We have people who seemingly are less focused than ever, and we're prescribing more stimulants. We have people who are more depressed and anxious, we're prescribing more SSRIs. If they really work that great, you wouldn't see those numbers, especially with the disability numbers. I mean, it's clear. The other thing that Nassim Taleb is great at, and this is from his Beta Procrustes books, but he makes a lot of wise observations about the medical system, such as pharmaceutical companies are better at inventing diseases that match their drugs than they are at inventing drugs that match existing diseases. So we are also being pulled into intervening with things. Nassim also brings up the idea of neomania. Everyone wants the newest, latest thing. And you probably can tell from my talk, I think that time is really important, and the wisest, it is the thing that filters through ideas. And things that are old and traditional actually have a lot of wisdom. They've passed through the years. And so when you are throwing away, and speaks to like indigenous culture wisdom, it speaks to wisdom of the great books and the great religions, it speaks of these things that have all been passed down for many, many years. And in modern medicine, we seem to not count any of that at all. If it doesn't have a study in our modern thing, which we study so few of things, then we're discounting it. So I think it's really important. The Lindy effect, which I put on there, is the idea that if something has been around for a long time, it will probably be around for a long time. So, people read Plato today, it's 2,000 years old. Probably in another 2,000 years, they'll still read Plato. And it's so the good ideas and the important things stay with us, and many of the things that are not important fade over time. And all you need to do is read a 1-week-old newspaper, and it'll cure you of reading newspapers. All right. So one of the things, and in this integrative community, I found some things that I thought that were really sensible and smart that I didn't find anywhere else. So Eugene Arnold has this great paradigm for how to look at look at our treatments. This SECS, sex, which is safe, easy, cheap, and sensible, versus rude, risky, unrealistic, difficult, or expensive. So when we're looking at complementary alternative interventions, and this is out of an ADHD, he uses his paradigm for other things, but we got to look at these things. These are really important measures of whether something is going to be used. And I feel like if it's safe and easy to use and cheap, then the barrier of trying something is much lower and makes much more sense. And it seems in medicine, we're only really emphasizing the things that have gone through all of our protocols and studies, and they're usually more serious interventions. And I don't know that they really increase natural healing all that much. And many times they're risky and expensive. And so, is this really the right way to approach something like, let's say, a kid's behavior or learning problems by adding a medicine that, may or may not in the long run really address, what's going on with their learning. So the other thing that I really liked in the same article from Eugene Arnold and his group is when they are looking at all these different treatments, they say, hey, these are the treatments. And then they say, what's the, status of clinical recommendation, why recommended for, this is a chart, but if I brought up the whole, I put up the whole chart, it'd be teeny, so you wouldn't be able to see it. Why not recommended? And then so they would give you like, hey, this is, not a lot of studies or what. And then if you are going to recommend it, what are the risks that you monitor? And then other comments. So really nice, like a layout of how to look at, in this case, treatments for ADHD. I definitely encourage you to look at this paper and have a look. Most of the science has not moved on that much, so it's actually really, even today, clinically relevant about, hey, you got a kid with ADHD, what are the interventions that you could possibly try? All right, and now I'm moving to my treatment paradigms. And well, I should actually say this is living and treating, but my title was, heuristics, rules of thumb. That's what we need to do, because the world is so complex, and all the decisions we're making as treaters, and then people are making for health, they are making them in these environments where we really don't know exactly what are the risks and what are the benefits. We do our best to figure it out, but we don't know. But if you look at the underlying principles of what people need, that will get you to a better result than all sorts of complex calculations, like how many calories do you exactly need to burn, or how much, vitamin D do you need, or how many exactly miles do you need to run in order to be healthy. What you need is the general principle. And so if you think about eating food, moving, and honoring silence, which I borrowed from Andy Weil, this will cover a lot in life. It really, the only thing it doesn't cover, I would say, is the social component, which I could give you a whole another talk on. So this is stolen from Michael Pollan, Eat Food. He says, eat food, not too much, mostly plants, in his book, In Defense of Food. Amazing book. It talks about nutritionism, which is very similar to the reductionist way we do science and medicine. So the nutritionism is, hey, let's measure all the carbs and measure all the fat and measure all the vitamin D and this and that. And then ask people to measure all these things when they eat. I mean, it doesn't work. People have not been eating better since they've done that. And it's gotten people away from the more important thing, which is just eating minimally processed food, stuff that goes off of gardens and out of trees, stuff from nature on the outside of the grocery store where no one gets hurt. They all get hurt in the middle. So that's where we need to push people. And then you don't need to do any calculations. Your body has sensors for how much of these things. You will do fine if you eat this. I know in other presentations these same studies will come up, but there is a study for basically a hybridized, Mediterranean diet and depression. These things do help, and we need to be pushing people towards things that both are good for their physical health and their mental health. And if you look at the CDC, stats, only 12% of adults are getting the daily fruit recommendation, and 9.3 getting the daily vegetable recommendation. So what are the consequences for what the standard of My American Diet is? I think if you look at the Kaplan and Rutledge book, they make a very strong case that we have multiple micronutrient deficiencies widespread in our population, just at the same time that we've had more and more mental illness, cognitive decline, focus problems. All those things go together. And so we need to move back to really more traditional type of diets, or diets that come from nature. And I do think supplementation makes a lot of sense if you believe Kaplan and Rutledge's a formulation. Drew Ramsey also has a great program about depression. So his Eat to Beat Depression and Anxiety, that's a great, that's a really nice book, has lots of concrete stuff about nutrition, and once again, very whole food oriented. And these are a list from the antidepressant foods from one of his journal articles. Okay, rule 2, move. So what do fish do? What do birds do? What do you do? So I usually ask patients, and usually they say, I sit, So fish are supposed to swim, birds are supposed to fly, and human beings are supposed to walk or run. This is a picture, or is there because I will mention later the book Born to Run, and this is about the Tarahumara Indian running alongside the ultramarathon, and it just shows there are cultures where people run long distances naturally, and whole groups of people that can run all long distance without problems. And so it's just humans are made to walk or run, and probably long distances, and we're really able to do that, but we don't do that. I mean, we're measuring our steps and trying to get enough, and maybe that's up to 10,000 steps is what people aim for. Most people don't even get anywhere near that. And if you're not walking, you're probably not going to be a healthy human being, because it's such a basic primary movement. Beyond walking, we need to be moving all of the parts of our body. So Katie Bowman has some great stuff about what she calls nutritious movement. You should think of movement like food. You want a nutritious diet with a little bit, you wouldn't eat the same thing all the time. So you can't just do one exercise all the time and think that you're going to be in good physical condition. We also have to move. There's two different sort of principles. One is that your joints will lock up and get contracted if you don't move them. And the other is that our bones will get weak if we don't pound them. And when you got the average American spending 50 to 70% of their time sitting, it's not going to work. We're not going to be healthy. The other thing is to stack your life. She says stack your life. It means I'm going to go back a slide to keep on this. So stack your life means you need to be doing things that bring together all the stuff that you need in your life. So if you're going to play let's say a fun sport that brings you leisure time and release, and you're getting physical activity, and you get to hang out with your social group, then you have all sorts of things brought together. And even better if it's outside time. So we need activities that bring a bunch of stuff that we need together, so we can efficiently get everything done that we need, and get what we need in terms of physical activity, leisure, and time with others. If you look at the comparison, the modern worker has the weaker bones than our ancestors. There's the Born to Run book I like so much. And John Ratty's book, Go Wild, also has a lot of great pointers. And it's kind of the same theme of all the stuff that I'm telling you, he's already said in a book. A really wonderful, and he's a psychiatrist, so see, not all psychiatrists are ignoring these things. And then the last rule is what I call honoring silence. And honoring silence means a few things. For one, we all need sleep. For two, we need some type of calming practice. I mean, it's great if it's mindfulness. It's great if it's breathing exercises. It's also great if it's warm baths or prayer or whatever works for you. But we want people to have a regular turning on of their calming system. Your parasympathetic system in a lot of psychiatric patients is relatively weak. Their sympathetic system is working overdrive. We need them to actively work that for a while to get those in balance. And then with today's media, we need to avoid digital distraction and all the toxicities on the media. Don't watch the news. It's only the bad news, and it's bad for you. Better to avoid it. This is a classic, mindfulness-based stress reduction versus Lexapro. We know that they, both reducing anxiety symptoms. It works if you work it. Breathing exercises, obviously heavily promoted in the any WOW community. I mean, they're cheap, they're easy, they're they're available to everyone. I mean, why we're not doing this? Plus, breathing is a part. A lot of the evidence-based cognitive therapy protocols, which people use all the time, use breathing as a technique also. So it's interesting. There's a nice evidence base for breathing built into some of those, but it's really not talked about in mainstream medicine, and we really need to utilize it. Yet, and we do, but a lot of other parts of medicine don't. Tuning in back to the mindfulness, if you can just be in the present non-judgmentally, recognizing mental chatter, tuning in, mindful walks, mindful showers. You don't need to have a sitting process. You can sit, but you don't have to. This is a mix of motivational interviewing and trying to help patients move forward. I like these type of charts better, because you say, is it impossible? You could do it sometimes, you could do it most of the time, you could do it almost always. And then you go through interventions and you find where they're going to change, and you work on them changing the thing that they're willing to change, or moving a little bit. Can we get from could do sometime to could do most of the time with a media fast, or turning off electronics before bed, or increasing positive communication? You can notice this is a child and electronics related one. And so this is another one for food, super salad first, cooking together, getting out the sugary beverages, but you're just trying to move people along. That's how you get, you get the ball rolling and you get some success, and then you'll be able to get more. And the last thing that I'm going to cover and say is a problem today, especially with the younger generations, we've laudably had a anti sort of stigma campaign through our society. We don't want to give people who are suffering a hard time. We don't want people who are suffering to be treated poorly. However, it's a continuum, and we also have illness identity. And Anna Lemke in Drug Dealer MD says, and I think this is very important for psychiatrists, the adoption of illness identities is driven by the breakdown of traditional social roles. Illness provides a way to define the self in a rapidly changing and increasingly fragmented world. And I think a lot of our patients are identifying with the labels. And I think psychiatry as a business and as an industry has not thought about what are the possible negative connotations of these labels that have now proliferated through society, and people take them very seriously. And we need to be very cautious about how we promote these things. All right, so I'm at the end. I will stop my sharing and answer questions.